Hello, and welcome to the Hot Seat series, brought to you by the Turing-Roche Strategic Partnership. Dive into the heart of health and data science with us as we spotlight researchers from our partnership. Before we get started, a little background on the partnership. Our 5-year strategic partnership is between the Alan Turing Institute, the UK's National Institute for Data Science and AI, and Roche, the global healthcare company. Our collaboration officially launched in June 2021. Our partnership North Star, which is our guiding aim for the 5-year collaboration, is to enable the generation of insights to better understand patient and disease heterogeneity and its relevance to clinical outcomes at an unprecedented level of precision in order to improve clinical care. Put simply, we're investigating why patients respond differently to treatment and why diseases manifest in different ways in different people. Our research is focused into 3 different research themes of structure missingness, predictive modeling, and multimodal analysis. To find out more, you can check out our webpage. The Hot Seat series will interview researchers from across our partnership and these research themes, aiming to give you accessible information on our research, whilst letting you get to know the researchers themselves in an entertaining way. Each video will consist of researchers teamed up to compete for points against other teams.
Hello and welcome to the 3rd edition of Hot Seat. My name is Sarah McGough. I'm one of the scientific leads of the Turing-Roche partnership. Today for our fun game, we are so excited to welcome Fiona and Mahwish, who are both researchers within the partnership, focusing on multimodal analysis. Let's introduce the rules of the game.
Hot Seat videos will feature Turing-Roche researchers teamed up to answer questions on partnership research and data science and AI in health more generally. After each answer, our researchers will be scored by our partnership judges, who will hold up an emoji. The smiling face is worth 1 point for a solid answer, the heart eyes emoji is worth 3 points for a great answer, and the heart emoji is 5 points for a standout insight. Whilst our researchers are scored individually throughout the game, their scores will be combined at the end, and this score will then compete against other teams in next editions of Hot Seat.
All right, now let's hear from Fiona and Mahwish. Tell us a little bit about yourself. Fiona, do you want to go first?
Sure. My name is Fiona. I joined the partnership in February of this year, 2024. And as has already been mentioned, I'm working on the multimodal analysis stream of the partnership.
Wonderful. Welcome. Thank you. Mahwish?
Hello, I'm Mahwish. I'm part of the data wrangling team. I also joined the partnership, I think around the same time as Fiona, maybe a little bit later. Also as part of the multimodal analysis stream. I work alongside Lewis Santos, who's also a data wrangler. Yeah, so nice to meet you all.
Great. Thank you so much for participating. All right. Next, we're going to introduce our 3 judges from the Turing-Roche community. Zeena, we'll start with yourself. Please introduce yourself.
Hi, everyone. My name is Zeena. I'm a PhD student at UCL and also a Turing-Roche community scholar. I'm looking forward to hear our contestants' answers today.
Great. Thank you so much. Kuniko.
Hi everyone, I'm Kuniko Paxton at the University of Hull and the Turing-Roche community scholar. Thank you very much.
Great. Now finally, Vicky.
Hi, my name's Vicky. I'm the community manager for the Turing-Roche partnership, and I'm very excited to be a judge today.
All right, let's get started. Okay, so we're going to start this interview series with the first round called Less is More. So both of you will need to please describe the concept of multimodal analysis in 5 words or less, and then tell me a little bit about why you do that, what words you choose. So Fiona, how about you go first?
How many attempts do I get? Just one.
We'll stop you after 5 words.
Just pictures, not full picture.
Okay.
Oh, I
Judges, you
should
want to
probably
start?
explain what's going on.
Why don't we get votes going for Fiona while she's explaining that?
So it's a bit of a contrived one, but pictures are a common sort of image data is a common kind of data using machine learning, but it's obviously not the only kind of data. So if we're only looking at imaging data, then we're not getting the full picture of what's going on with the problem that we're trying to solve.
Very nice. Okay, Mahwish, your turn.
I don't mean to copy Fiona, but I'm thinking along very similar lines. So for me, it would be complete picture using various data sets. Very similar explanation, where I think you can't get a very holistic view of, say, in this case, clinical information. If you're looking at a patient, you can't get a holistic view of the patient's health if you're only looking at just imaging data or just genetic data. So that's kind of why I use the word complete picture using various data sets. But oh, so similar.
Love that. All right, judges.
Okay, next time you get to go first.
Yeah, we'll flip the order next time. So judges, hold up your votes for Mahwish. Okay, thank you very much. Moving to the next question in this round, less is more once again. Please explain now the Turing-Roche approach to multimodal analysis in 5 words or less. That's a big one. So we'll flip the order now, and Mahwish, you'll go first.
Ooh. So explain the Turing-Roche approach to multimodal analysis. So I would say specialists together analyze cancer data. So I say this because I think it's quite specific to the Turing-Roche approach, where we have multiple specialists from different domains. So we have data wranglers, we have like clinicians, we have multimodal experts like Fiona yourself. So everyone's working together to analyze this cancer data. So yeah, that's my explanation.
Wonderful. All right, judges, hold up your votes for Mahwish. Thank you. Okay, Fiona, how about you?
This is a tricky one. I think, yeah, I'm not going to get something quite as succinct as that. I think maybe to capture, let's say, lots of data, now what? To sort of emphasize the fact that we've got a lot of open questions within this theme of the partnership. That the ambitions are quite broad, so there are a lot of different avenues that we could go down, just starting with the fact that we have many different types of data available to us, and let's just see what are the best questions to ask and how to go about answering them.
They're very insightful. You both have managed to create very intriguing sort of taglines out of 5 words. And I've got to say, I was not expecting that. I was thinking it'd be just 5 adjectives like exciting, difficult, promising. So well done, both of you. All right, we're going to move into the second round. You can use multiple sentences.
We need to vote for Fiona.
Oh, thank you so much. Yeah, judges, hold up your votes for Fiona. Thank you very much. Okay. Now we'll move on to the second round. You can use complete sentences and multiple words for this. The second round is called Explain to Me Like I'm ... So, first question. Explain the importance of using multiple data modalities to your uncle. We're going to flip the order once again. Fiona, you first.
Oh boy. Okay. Just trying to picture my uncle. Okay. Let's try like an analogy. Just so we're not always thinking about cancer, which can be a bit of a downer. But okay, imagine that the internet connection has gone down, and you want to know how to get dressed, and therefore sort of predict the weather for today, but you can't check the weather forecast. So you could just look out of the window and then you could see things like cloud cover, maybe the trees are moving, so it's windy, and get a sort of very rudimentary sort of idea of the weather from that. But maybe, I mean, I know I wouldn't be satisfied. I would, at a minimum, open the window, stick my hand out to see, first of all, the temperature is a very critical aspect, and then maybe other things like humidity, which you can't sense from just your eyes. So here we've got the visual information and also the tactile information. So those are different modalities through which I'm taking in information in order to form my final overall prediction of what I think the weather's going to be. And this is sort of similar to what happens in multimodal machine learning. So like we've sort of discussed in our mini taglines, you know, we want to use as many different streams of data to get as most of a rounded prediction as possible. And I mean, it's not just that the individual modalities are sort of siloed in what they can predict, right? So maybe my rain prediction is maybe going to be dominated by whether or not I can see heavy black clouds. But similarly, like I also get a bit of extra information by feeling the humidity, for example, or if it's, I'm kind of stretching this analogy a bit thin now, but you sort of get my point, right? That some information streams might dominate, but we're also looking to get that sort of cross information where they might complement each other and help improve the predictions in different ways.
That's a beautiful analogy. Okay, judges, hold up your votes for Fiona. Thank you. Okay, Mahwish, you next.
I don't think I can come up with something as good as that. So I'm going to preface this by saying I'm not a clinician, so please don't take this as like expert information or anything like that. It's just to draw an analogy. So imagine you're going into a clinic and you're feeling super, super tired, and you go to the doctor and you're like, oh my God, I'm feeling really tired. Can you tell me what's wrong with me? And then the clinician does the observations and checks your vitals and everything seems fine. And he's like, yeah, you look fine. You're like, no, but I'm still feeling really tired. So at that point, you're stuck because your visual observation isn't enough for you to gauge whether a patient's feeling okay or not okay and why he's feeling tired. So at that point, you might order blood results, right? So you might think, oh, okay, maybe we can do blood tests. We can check like his vitamin B12 levels, his vitamin D levels, see if like that's the reason they're not feeling okay. And then you might also want to combine this with, say, like clinician patient history. So like, do they have MTHFR gene mutation? This is conveniently related to genes and genetics, but maybe they have this mutation, which is why they have low B12 levels. And what kind of medication are they taking? So looking at prescription data, which is might give you an idea of, oh, maybe they're taking metformin because they have type 2 diabetes, and that can lower your B12 levels as well. So I think like just trying to, I'm not sure this makes much sense, but trying to combine all these different data modalities to say like the blood test, the prescription data, the genetic test, like all these different modalities to get a more complete picture of patient health, and then also like how you want to treat your patient. So, you know, you might not just want to prescribe them a B12 supplement, but you might also want to give them some other treatment, or you might want to change the medication because that's like causing this low level of B12. Yeah, I don't know if that makes much sense, but just an example. So
All right, judges, pretend to be Mahwish's uncle. All right, hold up your votes. Thank you both. Okay, these are great responses. We'll move on to the next question in this round. Please explain the specific challenges of working with multimodal data from your perspective. This time, you're explaining this to a university student. And we will once again flip the order. So Mahwish, you will be first up.
So I think the challenge is in the specific challenges in having multimodal data. So I guess I'll take more of a data wrangling perspective. So from me, it is more to do with how do you standardize the data so that when you do combine all these different data modalities, you're not dealing with, say, inherent biases or missingness, which can be amplified later down the line. So, for example, if you are looking at longitudinal studies and you have patients that you're looking at over intervals of time and they drop out at a certain point, then you might want to assess those kind of things in your data set so that later on you don't have a model that is now using all these different biases and amplifying them with your predictions and then essentially invalidating your results. So I think that's sort of, from a wrangling perspective, like making sure your data is research ready before you try and combine them is what I would say is a major challenge. Yeah.
Yeah, nice one. All right, thank you, Mahwish. All right, judges, hold up your votes for Mahwish. I'm going to try not to add so much commentary to sway the votes. So nice one. Fiona, your turn.
Okay, specific challenges for a university student, right? So I guess I can assume that they're a bit more glued in than my uncle. So from a sort of machine learning and modeling point of view, if we have to sort of balance the fact that it's presumably a great advantage to have all of these different modalities to improve our predictions, but in a real world situation, we probably can't rely on always having those modalities available all of the time, which sort of ties in with what Mahwish was saying about missingness, actually. So, like going back to the previous analogy, let's say the window was jammed and I could only rely on my visual information. I should still be able to make a relatively useful prediction using just visual information, even though I would preferably also have the other modalities. But in the event that they're cut off, we should still be able to make some useful predictions while still understanding and properly taking into account the effects of having that other stream missing. So understanding how that might reduce our estimates in certain tasks and in others. So that is one thing. And then more generally within multimodal analysis, we have the sort of question of how exactly do we combine these data streams, right? So I mean, the weather analogy completely falls apart here because the data fusion happens in the brain, which is this magical black box, which we do not understand. So just thinking about sort of the artificial mode. Broadly speaking, we talk about three different strategies for data fusion. So there's early fusion, which is where you take all of your modalities and sort of squash them together into some unified representation, which is then ingested into a single model to do the learning and the prediction. We have sort of intermediate fusion, where you have sort of slightly specialized models that extract features from each modality, sort of project that modality into a sort of high-dimensional feature space, which you can then concatenate together to form the final classification on a sort of unified model. And then a late fusion strategy, which is really where you're training entirely separate classifiers on these two different types of modality, and you're only then combining the prediction outcome. So you're sort of maybe taking a weighted average, for example, of two different predictions from two completely separate models. So those are, and there are strengths and weaknesses of all of these different strategies. So it's up to us scientists and researchers to evaluate the different ones and figure out what is best for any particular problem.
Excellent. Okay, judges, hold up your votes for Fiona. Okay, perfect. Mahwish voted with finger hearts. Wonderful. So votes are coming in. Now we've completed 2 out of 3 rounds. So just before the final round, we want to have a quick check-in on the scores. So reminder, although you guys are competing together as a team against other teams of postdocs, your individual scores, we're just gonna give you a quick update. Currently, Fiona with 44 points and Mahwish with 30 points. Let's see how this changes now with the final round, because the final round is a super round. So judges can vote in the final round with multiple emojis so that you can actually stack points. This final round is called Research Roundtable. So just one question. So for your final points, each of you please give an elevator pitch on your work to a general audience. Fiona, are you ready?
Yes.
Yeah, all right. So you'll go first.
Okay. Amazing. Okay. Ding. First of all, please. So we're working on strategies for combining different modalities of health data to improve patient outcomes or predictions, understanding treatment responses, and improving patient care. So, I mean, if you think the luckiest patients will often have their cases discussed by a whole team of medical experts from various different disciplines. So like radiologists and oncologists and psychologists will come together and together come up with the best treatment plan for that patient. And so our ambition is just to make use of the data collection that is already being done and that will continue to be done for research, for clinical trials, and in the clinic itself, to sort of bring that kind of multimodal expert decision making to make it more widely accessible and efficient, and figuring out how we can best leverage all of this data to improve patient outcomes.
Ding, and we've hit the ground floor. Okay. Thank you, Fiona. Judges, hold up your votes for Fiona. Got lots of stacking points. Okay, great. Next, Mahwish, let's get started.
Oh dear, I cannot compete with that. I think you summarized the Turing-Roche partnership so well. I think mine's a little bit more, I'm going to be a little bit more specific to my work domain. So ding. So I'm part of the data wrangling team. We work on getting data research ready, and this involves a lot of things amongst structuring of the data, interpretability of the data sets to ensure people, the public domain, the researchers all understand the data. We work amongst domain experts and data scientists. So we're sort of the middleman that are supposed to help like transfer all this knowledge amongst the team. We are also supposed to be responsible for the setup of the infrastructure. So like, where is the data sitting? How do you ensure there's no like privacy breach? You aren't accidentally leaking patient information, those kind of problems you have to deal with. And just ensuring like standardization of the data sets. How do you ensure that all the different data sets that you're using are using the same kind of terminology models, and linking them together so that when you do provide like a complete picture for your patient, you have lots of information to do that. You're not just using like one thing in silo. And yeah, that's kind of it.
Wonderful.
I've tried.
No, thank you so much. Okay, judges, hold up your votes for Mahwish. It was really nice to hear both of you actually present your complementary perspectives that you're both bringing to this work. It's really important. So thank you very much for sharing this and for joining us today in our hot seat. Before we reveal the final scores, we really appreciate you taking part in this. How did you find the interview? Just want to pick your brain on that. You know, what was the most challenging question or the most fun one?
Should I go first?
Either
You go
one.
first?
Yeah.
To be honest, I think for me, the challenge is trying to explain things in layman terms. So it makes you reflect a little bit on like, I think I still use quite a bit of jargon. So, you know, like what does, I don't know, restructuring a data set mean to the general audience, or what does pre-processing mean to the general audience? If I am trying to explain this to my uncle, realistically, he probably doesn't really know what the MTHFR gene is. So yeah, it's just a lot of reflection for me. I did really enjoy it, and yeah, it gave me more of a, I guess, like a higher level perspective on the work I'm doing. Yeah.
Nice,
I
Fiona.
had a great time. This was good fun. Thank you for hosting. I agree, like covering things. I mean, I think you could say I kind of chickened out a bit in that last question and gave a very, very high level and vague and ambitious elevator pitch, precisely because I think Mahwish actually did a better job of being more specific and tangible in her explanation there. And yeah, it's tricky to put things in 5 words. I like the idea of saying 5 words or less, as if I was going to manage to do any of those questions in just 3 words. I've struggled enough to come up with only 5. So yeah, that's definitely a big challenge. As you can tell, I can waffle on a little bit. So maybe I should practice the 5 words or less thing a bit more frequently.
Your super elevator pitch. Yeah, perfect. Thank you guys so much. I mean, it was meant to be a good stretch, but also to really help communicate the research we're doing to a general audience. So we really appreciate you stretching your brains on that. Judges, did you guys have any final comments? Vicky, Zeena, Kuniko?
Yeah, thanks so much for taking part. I really enjoyed hearing from Mahwish from a data wrangling perspective, because I think this is a role that's like emerging and it's going to be kind of a more important role in research in the future. So that was really fun to hear about.
Wonderful. Anything else to add, judges?
Yes, thank you very much for joining it. And yeah, actually, I wanted to know about the multimodal project more, but I couldn't find a lot of information. So today, yeah, I was very happy to know about the project more. Thank you very much.
Yeah, stay tuned. The research is definitely a work in progress. We've kicked this research theme off in the last couple of months, really. So excited to be putting out some really cool research publications soon, and we'll be updating the partnership website with all of that. So this is a teaser. Okay, Zeena, do you have anything to add?
I just really loved how creative the answers were. I don't know. I think in some of the responses, especially the 5 words or less, I was similarly expecting 5 standalone words, but instead we got phrases, which is really cool.
Yeah, I really liked that too. Okay, great. So we will close out with our final scores. Fiona, you landed with 63 points, Mahwish 54 points. Together, you both combined your team score of 117 points. That's amazing. Now remember, you'll now use this total of 117 points to try to outscore the other teams that are taking part. So well done, both of you. This is excellent job. And we are grateful for everyone for watching. So we are going to compare all the scores across all the videos that we film, and then roll out the ultimate champions. But to everyone else, we hope this gives you an insight into the partnership research that we're doing. And for now, goodbye.
Hi everyone, we have reconvened as the judges of Hot Seat to tell you the final scores on the doors. As you'll remember, we had 3 teams competing this season. So we had, first up, we had Chris and Rohan, who are the theme leads for the partnership, and they gave us an overview of the partnership's research and its North Star. Our second team competing was Ioana and Ariane, who are research associates for the partnership, and they gave us an overview of the predictive modeling research theme. And our third and final team that competed were Fiona and Mahwish. Fiona is a research associate and Mahwish is a data wrangler, and they gave us an overview of the partnership's multi-modal theme. So we are very pleased to announce the scores. As you remember, each team was competing as a pair. So in third place, with a team total of 108 points, was Rohan and Chris. A little clap from all of us. And in second place, we had Ariane and Ioana with a team total of 111 points. So well done to those. And our winners of this season were Fiona and Mahwish with a total of 117. So very close between the teams, but huge congratulations to Fiona and Mahwish for being our winners of the Hot Seat video series. Thank you again for everyone for taking part, and thank you again, judges.